So I think you have some idea about, we've started with pediatrics, so you have some idea about what is growth, what is development. Do you understand what is growth? For instance, a child who is born, he is born at about 2.5 to 3 kg. Then the weight of the child keeps on increasing, right? When the child is born, he is about 50 centimeters long. So his height keeps on increasing. His head is around 35 centimeters, it increases to about 47 centimeters by the time he is 1 year of age. So these are something which you can measure, and they are increase in size of the body. That is increase in the number of cells, increase in the size of the cells. So that is called growth. So growth and development are two different things, right? So when we talk of development, it's basically acquiring new capabilities or new milestones, the capacity to do something. For instance, a child who was able to see is now able to see that thing and hold out for it. A child who was able to initially just lie, he's now able to control his back, right? So they may not go hand in hand. In a normal newborn, if everything is normal after birth, mostly what you find is the child continues to grow in height and weight. That is, growth is also very important. And the child continues to gain certain milestones. That means he's developing also nicely. Now, if there is some problem with either at the time of birth or at some other point of time in the form of asphyxia or infection or severe jaundice or severe pneumonia, anything which can damage a growing brain, you will find that some children may continue to grow, but they will not develop. And you want both of them to go hand in hand so that the child is normal. So what I want you to know by the end of this lecture is what is development, right? It's not the same as growth, right? And what are the normal milestones? So here we're not going to discuss abnormal milestones, but before you know what is abnormal, you have to know what is normal. What do you expect a normal child to do, right? And how will you assess development? So parents are saying, for instance, is the first child, and the mother says, "Sir, मेरा बच्चा तो बहुत होशियार है, हर चीज करता है." But it is your assessment as a doctor which will tell you, is this child normal or is it some deviation from the normal? Because if you correct something at the very beginning, the child can have optimal development. So it is actually a mature way or acquisition of certain skills, the ability to do certain things. So it's a multi-dimensional trajectory, right? So it's basically acquiring milestones, acquiring the ability to do some things, or acquisition of certain skills which will help the child to attain certain milestones. So I want you to know the difference between growth and development. So basically when the child is growing, we talk of first 1000 days, right? Because what is the first 1000 days? It's a window of opportunity that we have. So you know that 9 months of a child's birth is inside the mother's womb. At that point also the child is growing very rapidly. And that is inside the mother's womb. But whatever she eats, whatever stimuli she gets, if she has an infection or she has some other problem, that is also going to impact the baby lifelong. Then that means the first 9 months is roughly 270 days. And out of this, the first 2 years of life, that is around 700 days, 730 days. So the first 9 months, that is intrauterine period, and the first 2 years of life, they comprise the first 1000 days. And this 1000 days is a time when the child's brain is rapidly growing, right? So the child's brain goes to approximately 90% of the adult brain by around 2 years of age. And if you find that the child does not have all the things that he needs in terms of nutrition and stimuli, his brain growth will suffer. Similarly, if he has some problem and you find you are giving the child some extra stimulus, some extra effort, you will find that it will give you very good results. Because this is that point of time in which the brain is developing very rapidly. So initially, if you must have studied in neuroanatomy, you have the neural plate. Actually, the cells migrate. So that is the stage of neuronal migration. Then they form a lot of synapses. That is synaptogenesis, right? And the myelination and synaptogenesis, it all starts in the intrauterine period. Then a lot of synapses form. And some of them have to get removed, pruning. So that starts in the later neonatal period. And different parts of the brain undergo different types of the hippocampus, especially for memory, they also mature. So what you find is that if in this period, this is the window of opportunity that you have, if you detect that a child has some form of delay, you can give certain interventions which will have optimum results. So when we talk of domains of development, we're talking of development, so child is acquiring different milestones. He's acquiring certain gross motor milestones. Gross motor is the most easy. Why? Because we are able to see it. That means the development, last time you must have studied the laws of development. So one thing is development proceeds in the cephalocaudal direction. That means first you will attain neck control, then back, then lower limbs and hands. You cannot do vice versa, right? For instance, I had a child today, the child had infantile, he was a global development delay, he was having spasms. And the child was just like this, he was like a newborn period, he did not even have neck control. So he had come to me last month also, so we had started him on physiotherapy. So first what we will focus on was neck control, because I know till he doesn't attain neck control, he's not going to attain back control. So we put him on his back and we showed him a lot of colorful things and bright toys, and the mother used to speak to him, so that slowly he began to lift his neck. So this time what we saw is when we put him on his back, he was able to lift his chin up to 45 degrees. So he had attained a little bit of neck control. Now if this neck control becomes a little bit better, then I will emphasize on his head and I will try to control his upper back. So what we have to see is the milestones that have to do with gross motor, like neck control, sitting with support, sitting without support, standing, walking, running. These are the gross motor milestones. Then fine motor, child is scribbling, he's putting toys, right? Then he's picking up something and eating. Now you can't, if you give a newborn something, you'll find he's just he holds things like this. As he becomes older, you'll find that they start holding like this, then with the proper, you hold a pen and pencil, they start getting a proper grasp. So even though it seems so simple for us, but for a child, these are all milestones that they acquire, and these are your fine motor and skill development milestones, right? Then you have personal and social and general development. That means this is also very important, because nowadays you must have heard of autism and autism spectrum disorders, in which you find the gross motor milestones are almost normal. The child is walking, sitting, talking, but he's not interacting. So that also, after some point of time, the child starts interacting with the parents. He knows that this is my cell, this is my hand, this is somebody else's hand, right? He starts interacting with another child. Initially they have parallel play. They start playing simultaneously. Then they start interacting with a toy. Then they start playing with the child, with another child. So that form of interaction is also very important for social development. And when this development is hampered, then you have a spectrum of disorders, that is autism spectrum disorder. Then language. When a newborn is born, does he speak anything? After some time, they start cooing. Then they start saying mama, ma, just a monosyllable. Then baba, mama. Then by the time they're roughly 1 year of age, they start calling pani, they start calling water mum. They start having some jargon speech. Then by 1.5 years, they acquire 2 to 3 words with meaning. Then single pronoun, mummy khana de, they'll start speaking a small sentence using a pronoun by around 2 years of age. So that is language development. Now, sometimes for that you also need a child to be able to hear, because language is both receptive and expressive. So he should be able to hear and interpret it, and then he will be able to speak. So if you have a child who's not able to hear, so everything else is normal. He's walking in time, he's sitting in time, he's got good milestones, he's putting everything together, but he's not able to speak. So if you take the history, you'll find that only one parameter is delaying, that is language. Probably he's not hearing. Put a cochlear implant to help him hear, and then you find that suddenly the child starts speaking. If you're not able to identify him on time, you identify that he's not speaking when he goes to school. But by that time, you have lost that period of synaptogenesis. That means, now if you give him a cochlear implant, he'll be able to speak few words with meaning. He's not going to be a normal child in the sense, he's not going to study like a normal child. For a normal child, he should be able to speak in class, he should be able to interact with other students. Now he's going to have a limited vocabulary with a lot of effort of probably 15 to 20 words. He's not going to have, because his synapses have developed completely. It will not be so easy for him to acquire these new skills. So that is why developmental assessment is important, because we would like you to identify all these delays at a proper time so that intervention can be given. Then vision and hearing. For instance, a child who's born, so he's able to see his mother at a small distance. Usually when the mother breastfeeds, that is around 8 to 10 inches. That is the distance that he can see. If you put him too far, he doesn't see anything. He's also able to see for a small distance, 45 degrees. Then as he grows a little older, he's able to see a little more. Then he develops binocular vision and interaction. So that is also development. Hearing also, initially you will find that the child, whenever there's a loud sound, they tend to startle. And later on, they turn their head to sound. They're able to localize. Then after, as they grow, they're able to localize. Whenever they find that the sound is coming from this corner, they're able to look and see, okay, this is coming from this corner. So all these milestones are, whenever we assess development, we assess all these parameters. So what does the child do at birth? So a child at birth, he's lying down in the back and he's moving his limbs. Now in this also you can find an abnormality. Normally children have a good flexed posture, right? And their tone is against gravity. They have a good anti-gravity tone. If you find that the child is limp, he's lying just like this, hands and feet are in the frog's legs. He cannot move his limbs against gravity. That tells you something is wrong. And he's able to momentarily fix his gaze at somebody. Like for instance, the mother is breastfeeding, so that is the distance at which he should be momentarily be able to fix the gaze at the mother. By 1 month, you'll find that the child, when you put him on the back, in the supine position, he'll just be able to turn his head on one side to prevent his neck from getting pressed. At around 1 month, he'll be able to lift his chin a little momentarily for 45 degrees. But if you pull him from the sitting position, if you pull him, you'll find his head is lagging behind. And then he starts developing a social smile. Right? So what is a social smile? So normally children have two types of smile. One is intrinsic. They're just lying like this and they smile. So that is not social smile. Social smile is you see your friend, for instance, you see your friend and you smile. That means you're recognizing that person. So social smile is the child sees the mother or somebody whom the child knows, and in response the mother is cooing at the child. So if he's okay, now my mom has come, she's going to lift me up, or I'm going to get milk, something like that, and so the child smiles. So that is social smile. So these are the motor milestones in the first year. I'm going to discuss in the first year because there are so many milestones, we tend to get a little mixed up, and then from 2nd to 5 years we are going to discuss. So again, there is no shortcut. I'm a pediatrician, so I deal with all these kids all the time. So for me now it is easy to recognize. But when I was your age, what we used to do is we used to take small pieces of paper and we used to write these milestones and keep it in our pockets. Every time, whenever there's a time in between the two classes, we used to keep on reading because there's no way you can learn it otherwise, right? And there's no shortcut to it. You can't open your book when a patient comes to you and she says, "Doctor, mera bachcha 6 mahine ka ho gaya hai aur abhi tak gardan nahi padta." And you say, "Oh God, is it normal? What is the child expected to do?" You can't do that. So there are certain things like vaccination and milestones that you have to know because they are so common and most of the parents will know it because they've got 2 or more kids. And if the doctor knows less than the patient, it doesn't look good. So there's no shortcut. Initially, you'll have to learn it. And as you come in contact with patients, it becomes easier. So if you learn it once in this posting and then once more in the next posting, by the time you come to final year, you have learned it. It's become part of your knowledge. So by 3 months, the child holds the head steady. So whenever you're holding, the mother holds the child in the lap, initially she has to support the head of the baby because it tends to fall back. By 3 months, she will be able to leave the head of the baby and the child will be able to hold that. She will just have to support the back and the child will hold the head. By 4 months, when she holds the head of the baby, the child is able to look side by side also. Right? And when she puts the child from the sitting position, he's able to hold his head properly. It doesn't lag behind. Then between 4 to 6 months, he rolls over. What they say, palat jata hai bachcha, palti lene lagta hai. So how the child initially rolls over from prone to supine and then supine to prone. But like in the Western countries, they mostly put their children in prone position. And we usually Indians, we put our children in supine position. So we usually miss that milestone. So you'll never find them saying prone to supine. So usually you get this milestone a little later. 6 to 7 months where they'll say that the child rolls over. And we don't want to change it. Why? Because the incidence of SIDS, that is sudden infant death syndrome, is much higher in the Western countries. And they tend to put their children in prone position. So probably it has something to do with prone positioning. So I think culturally we put our children in the supine position. So this is the only milestone that probably we don't get. But we have lesser incidence of SIDS. So we should just emphasize on supine only. Then sitting with support is around 7 months. Sitting with support means they put a small pillow in behind or the child puts his hand in front. Without support means they put the child like this and he's sitting comfortably. That comes at 8 months. The child is able to stand up at 10 months with support, and at around 1 year he begins to cruise around. What is cruising? So if you have a table And nearby you've put a stool and then you've put a bed. So the child holds the table, then he leaves that table and he latches onto the stool. Then he leaves that stool, he catches the bed. That is called cruising. So at 10 months he's able to stand up, and at 12 months he's roughly able to cruise. Then he begins to walk. Then in fine motor, usually rattle is junjuna. So child is able to hold a rattle at 4 months. So initially they try to hold it with both hands. That is a bidextrous grasp. Right? And he's able to reach out. So now what he has developed is hand and eye coordination. He's seeing something with his hand and he's able to hold it with he's seeing it with his eye and he's holding it with his hand. So initially it is bidextrous grasp, then it becomes unidextrous, and then he's able to transfer object from one hand to the other. Then when he starts holding things, he starts holding things from the ulnar side. Right? So whenever you give a child a toy or you give some rubber eraser or something, initially you will find that the child begins to hold like this. Then it starts from the ulnar side, and ultimately by the time the child is around 9 to 12 months of age, he starts holding it from the finger and between the finger and thumb. So that is called pincer grasp. So initially it's a bidextrous, then a unidextrous grasp, and then a pincer grasp. And pincer grasp is also initially immature. It's from the ulnar side. And gradually it shifts to the radial side and it becomes fine pincer grasp between the finger and thumb by around 1 year of age. So now we are coming back to the milestones that we have discussed. At 2 months, at 1 month, he said he's able to lift. When you put him in the prone position, he lifts his chin a little bit. After that, he's able to lift his head a little more and he's able to follow objects 180 degrees. Now he's got a proper social smile and he recognizes the mother's voice also. So you can see the baby is interacting, right? He's got a social smile and now he's trying to reach out. He's seeing all these objects and he's trying to reach out. Right? In the prone position, you can see this is the good tone of the baby. So this is a newborn. They put the child on the supine position and he's just prone position and he's just turned his head to one side. Right? And here the child, even at birth, you can see, he's looking at the mother for some time. He's able to gaze, he's able to look at the mother even at the time of birth. Gradually you find the child he's able to hold his neck. Now he's here, what is he doing here? He's looking at the mirror image. This is at 6 to 7 months. The child he's trying to find out all about his body. So there's a lot of, he's trying to, his upper limb, lower limb, he's trying to find out about himself. The child is grasping objects, see? Right? And here he's also playing with the toy. Then gradually the child learns to sit up on his own. That is, he's sitting with support at 5 to 7 months, 7 to 8 months without support. Then at 8 to 9 months he begins to crawl. At 1 year he can stand and cruise. Then he can also manipulate large objects. So here you can see he's playing, he's standing, he's trying to stand up on his own. He's trying to interact. Now he's trying to fix this. He's found this and he's trying to fix it in the object. Here this is also a very good milestone because this child is socially very good because he is not only interacting with himself, he's got a toy and there's somebody else in the room with whom he's trying to interact. Here again, he's got an object and he's trying to play. So this is a very good social development. Plus you can see neck control, back control. He's sitting completely without support at around 8 to 9 months. Here again, he's got good social interaction, right? Proper back and head control and he's trying to reach out for people. So now he starts responding to his name. At around 9 to 10 months, he understands the meaning of no. If you tell him no, then he'll stop doing it. He knows that his name. So he can say, you ask him what is your name, he'll be able to tell what his name is at around 3 years of age. But at around 9 to 10 months of age, every time suppose a child's name is, they call him Ravi at home. So if they keep on saying Ravi, 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 you'll find he looks at you. So at 9 to 10 months, he knows his name is Ravi. But if you ask him what is your name, at 3 years only will he be able to tell you my name is Ravi. So that is being able to speak is something else. But knowing that your name is around 9 to 10 months. Then he also has an urge for autonomy. That means now he wants to play with something, he wants to eat. And if you try to interfere, he shows a little bit of temper tantrums. Right? And he starts the meaning of simple commands. If you tell him, tali bajao, naak pe ungli likh ke dikhao, so he starts following some simple commands. Right? Voluntary release of objects around 1 year of age. Then he begins to cuddle a teddy bear. He begins to point at body parts. Right? Joint attention. So that's what I was telling you. He's got a toy. So that is joint attention. He's showing that toy and he's interacting with somebody else also. Now this is another important thing. That is where we say peekaboo. If you must have seen. So if you look at the child and you say luka chipi, that's what we say. Okay? We hide and then we look back again. Usually children enjoy that play. Or if you show the child a toy and then you hide it. Now initially the child will not find it very interesting because he feels, okay, this thing was here, now it's gone. But now what the child knows is that this is hidden somewhere. It's going to come back. That is called object permanence. Right? So that comes at around, and this is a very important point. The child who understands, who responds to his name, who's got object permanence, is likely to have a normal social development. That means they will not go into that autism spectrum disorder. So these are very small, subtle features that you get. They don't understand object permanence. And if a normal child, if you play Luka Chippy, you hide and he knows, okay, like I'm not able to see my mother, but she's there. Behind her hand, she's still there. So they know that even though it's temporarily hidden, so that is called object permanence and it's a part of growth. Then the child starts playing with multiple objects. You give them a katori or a chammach and a pellet and other things and they start putting the pellets inside the spoon, katori. So they start playing with multiple objects. So here you can see they are interacting and they are playing, right? This is proper pincer grasp. So here the child is having proper social interactions. This is stranger anxiety. So these are communication and language milestones. The child's response to face, there's a monosyllable, inhibits to know, follows a one-step simple command, one-step command without gesture, with gesture at 7 months. You tell him, pehle aise ki aap tali bajao. Then you just tell him tali bajao. So after that, the child will be able to follow that. Then bisyllables, mama, dada, something like that at around 10 months. Then again pointing to objects. So where is mama? They start pointing. Speaks their first real word, that could be a jargon word. I told you something like everybody, it's a Muslim family, everybody in the family calls the child Ammi, but the child says Mama, Mama. So that is a word that the child has made for his mother. Similarly, you want to teach him pani, 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 or water, 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 but the child says Mum, Mum, Mum. For that child, that word has a specific meaning. Right? So they start playing, they start noticing small objects, they start developing pincer grasp, they start imitating. Bye bye, tata, pat a cake, they start enjoy playing. They again, concept of object permanence development, separation, anxiety. So these are the cognitive milestones of a 1-year-old. They stare momentarily at spot from where the object has disappeared at 2 months. They stare at their own hand at 4 months. They bang 2 cubes. So they are able to hold 2 cubes and interact at around 8 months. Then they uncover the toy after seeing it. You take a toy, you hide it under the blanket, they remove it and they enjoy that play. That is around 8 months. Then egocentric play at around 12 months. So now I'm not going to discuss the milestones of the first. This is from your ghai that is given. So till 1 year we have discussed. I'm going to go beyond 1 year now. Right? So these are the language milestones. So by 1 year you have understood. So they have started with, they have become alert to sound, they have started cooing, they have got monosyllables, bisyllables and a few jargon speed by 1 year. Now at around 1.5 years, they start having 8 to 10 words with meaning. That could be their body parts or mummy, bua, so many people in the family or some common words like food, khana, pani, etc. At 2 years, they start using small sentences with pronouns. Mujhe khana do. Something small, 3-word sentences with meaning. At around 3 years, the child will know his name. That means if you ask him, aapka naam kya hai? So at 3 years, he'll be able to tell you Ravi. Right? At 4 years, they'll be able to tell you small songs, stories. If they're going to Anganwadi, if they're going to school, they'll be able to tell you some rhymes, Machli Jal Ki Rani, etc. And at 5 years, they'll be asking you questions. Why, what, ye kyun ho raha hai, aap kyun kar rahe ho? They'll pester you with a lot of questions. Then you have social and adaptive milestones. Again, we are going to study. Till 12 months, we have covered in detail. So we know that social smile has developed at around 1 to 2 months. 3 months, he recognizes the mother. How do you know recognizes the mother? Because even at birth, he is fixating at the mother. But at 3 months, if there are 4 people in the room, the child will preferably look at the mother. So that is called recognizing mother. So you know that initially the child will fixate at anybody who's looking. So he's not recognizing the mother at that point of time. But if he has got 4 or 5 people and he's now preferably looking at one person, you know that he's recognizing that person. Then 9 months, I told you, he waves bye-bye, and 12 months, he can play simple games. 18 months, he's copying the parents. Whatever the mother is doing, if she's wearing a dupatta, child is putting the same thing and she's following the mother. The father is putting spectacles, the child is trying to copy the parents. At 2 years, they start asking for simple things like pani do, khana do. Okay? 3 years, they know their name and they also know their gender. I'm a boy, I'm a girl, they'll be able to tell you by that time. At 4 years, now this is the time when they start playing cooperative. Now that is also important. You have got 2 or 3 children. The child is not limited to playing. He's sharing his toys. He's playing with the other child. So that is also important. At 5 years, he's able to dress and undress and help in household tasks. So mother is saying, beta pani le aao, chappal le aao. So he's helping with small things. And initially the child learns to undress. It's easier. Able to remove clothes. And then they learn to dress themselves. At around 5 to 6 years, some children are able to button themselves up and tie their laces also. Now, easy one way is to, whenever we have this developmental assessment, so this is what we tell children. One thing is you keep a cube, you keep some rows of blocks. So that is very easy to assess because all the other milestones, even if you don't remember, this fine motor, if you're able to make a tower of 2 cubes at 15 months, 3, 18, 2 years he can make a train, 2.5 years train with chimney, 4 years bridge, 3 years, 9 blocks, 5 years he can make a gate, at 6 years he can make steps. So actually giving a child blocks and telling them to make is another easy way to assess. If you don't remember all the other milestones, it is an easy way to do a developmental assessment by having a cube of about 8 to 10 cubes. So again, we've studied the milestones till 12 months. At 15 months, the child is now walking alone. At 18 months, he is running and he's walking up. At 2 years, he's walking up and down the stairs, 2 feet per step. That means he's walking up like this. 3 years, 3 for tricycle. It's easy to remember. The child begins to ride a tricycle and he goes up, alternate steps at a time. At 4 years, he's able to hop, and at 5 years, he's able to skip. Beyond this, a child goes to school. So in that case, you can ask, is the child doing the same activities that other children are doing? Right? So you can see the gross motor. At 0 to 3 months, you can see he's lifting initially just 45 degrees, then he's lifting up the entire head 90 degrees. At 3 to 4 months, he's able to raise the head. Then he's moving his hands and limbs. 3 to 6 months, he can lift the head and trunk also, he can roll over. 6 to 12 months, he's sitting alone, he's crawling, pulling himself up at around 10 months. 12 to 18 months, taking steps, climbing and walking well. 3 to 4 years, he can walk on the toes, he can jump, he can throw the ball. Now the fine motor milestones. So initially I told you they have a bidextrous grasp, then a unidextrous, then immature pincer grasp and mature pincer grasp. Beyond this age, we can give a child paper and pen and see what the child can do. Right? So at around 15 months, he's just able to scribble. Or if you're looking at blocks, then 15 months, 2 blocks, 18 months, 3 blocks. 2 years, he can build a tower of 6 blocks and he can make vertical and horizontal strokes. At 3 years, 9 blocks, or he can copy. 3 years, actually, you begin to draw a circle. Now that's important because we have other simple tests like good enough draw man test. So we know that at 3 years, a child is able to draw a circle. So if you want to do a developmental assessment of a child, beyond 3 years of age, we ask them to draw a child. So we can start it only beyond 3 years because that is the earliest age we expect a child to draw a circle. Now having said that, I've seen that children are nowadays, they go to school at around 2 to 2.5 years. So we find children even 2 to 2.5 years, they're able to draw circles. So these milestones are a little earlier. But if you are not doing a lot of effort, you're not putting in a lot of effort to teach, the child will learn these things spontaneously at this age. At 4 years, he can copy a cross, he can make a bridge. At 5 years, he can copy a triangle. So this is roughly what a child can draw. A circle at 3 years, cross at 4 years, 4.5 years rectangle, triangle at 5, right? He can properly draw all the diagonals like this at 6, rhombus at 7, a plus at 8, a cylinder and a cube at 9 and 11 years. Now vision, at birth also the baby fixates. At 4 weeks he can fixate at around 90 degrees. At 6 weeks he starts developing binocular vision. And then at 6 months he's able to adjust the position to follow the object of interest. For example, he's showing a rattle, he's able to adjust his position. Now he wants to sit or he wants to turn wherever he's seeing that interesting thing. You put the TV on, so he's able to adjust his position to see what he wants. At 1 year, he's able to recognize objects. You give him a tea or a cup or whatever, and now he's interacting. Newborn also, he responds to sound. If he hears his mother singing or hears the mother, then he'll keep quiet. He hears a loud sound or maybe the whistle of a cooker and he'll start crying. Right? At 3 to 4 months, he starts turning his head to sound. Initially, he will be able to turn, he'll be able to hear the sound, what is below his level. Then later on, even whatever is above his level. At around 10 months, he's able to see diagonally across the room. So if you have, the sound is coming from here, he'll be able to see absolutely diagonally opposite. That is how hearing develops, but hearing is there from the very time of birth. But the parental assessment of hearing is not very accurate. Because if you ask the parents, does your child hear? Sometimes the child is not able to hear small things. So if you have anything to suspect hearing, hearing assessment should be done. In fact, most of the countries, they have universal screening tests for hearing at the time of birth. Because parental assessment of hearing may not be very good. Because the child responds not only to hearing, he also sees. So the mother's, every time she's calling the child something and she feels that the child is smiling. She's saying, "Sab, mera bacha to mujhe meri awaaz sunte hi," but he's not only hearing you, he's also seeing you. He's also smelling you. So he may not be responding to only your hearing. So many times at time of intervention, when we detect hearing loss is gone and we are not able to do anything about it. So parental assessment about hearing may be very, very inaccurate. It should be more subjective. So whenever a patient comes to you, it's good to do a hearing assessment. Little bit about social development, because autism and autism spectrum disorders, you must have heard, is nowadays becoming very, very common, and parents would not like, they say, "Sir, hum to aapko shuru se dikha rahe the, aapne to hame kabhi kuch bataya hi nahi." So if you're not very sensitized, that social development, alteration of this social development is called autism. Child may not have a lot of problems with gross motor, fine motor, language development. So what we see is that initially a child has unoccupied play. That means till 3 months, also if you give the children a lot of toys, for instance, you saw that that equipment that we had. There was something hanging over the toy with a lot of colorful things that were hanging. So initially the child keeps on looking. It's only at 3 to 4 months that he starts interacting. So initially the baby is just fixating, he's just seeing. So that is unoccupied. He's got objects, but he's not able to play with them. Then between birth to 2 years, solitary play. That means you give him toys and he's playing alone. Then he starts having an onlooker type of behavior. That means you are playing, or some other child is playing, but he keeps on looking at that child. But he's interested. Then parallel play. That means there's somebody from the neighborhood who's coming, and they've got toys. He's playing with his set of toys, and the other child is playing with his set. So they're not interacting. You've got given them 2 cars. So this child is playing with 1 car, and the other child is playing with the other car. It's only by 3 to 4 years you'll find they'll say, "Ab hum race lagate hain." So initially, one child will be playing with the blue car, the other child will be playing with the yellow car. And they are doing that khatar patar and they are playing. Once they are older, they start racing. They'll say, "Main police hu, tu chor hai. Main tere piche piche hu." So that comes a little later. That is associate play by 3 to 4 years. Then cooperative play is at 4 years. That means, ab hum 3 jane jo hai, yahan par aate hain and we'll do a race. So that comes a little later. So this is unoccupied. So between birth to 3 months, this is unoccupied. If it is persisting in a child who's 6, 7, 8 months, something is wrong. Similarly, till 2 years, you'll find the child should be coming to the solitary play stage. He should not be in this stage. And by around 2 years of age, he should have this onlooker. Some other child is playing, he should be interested. If he's still in this stage, again, something is wrong. By 2 to 3 years, parallel play should be present. If by 2 to 3 years, he's just playing alone, if some other child comes, he's not interested at all, then that something is wrong. Similarly, between 4 to 5 years, we expect associative play, and beyond that, cooperative play. So how do you go about assessing the development? So first thing we do is we take a history. We want to know, are there any risk factors that this child could have developmental delay? Was the child born, for instance, if the child was born preterm, or a child was born but he did not cry after birth, or a child was born but he developed meningitis or convulsions or jaundice, some problem that has happened to the baby which could have affected his development, then you know that there are a greater chance of having developmental delay. And you ask him, when did this child? So usually gross motor milestones, most of you remember. So you'll say, बच्चे ने गर्दन कब पकड़ी, कब पलटना शुरू किया, कब बैठना शुरू किया, कब खड़े होना शुरू किया. So you want to know whether he's, so they are saying that मेरा बच्चा 2 साल का है और अभी तक चलता नहीं है. So you expect the child to walk when he's around 15 months. So you know something is wrong, is delayed. So what you want to know is, was it delayed from the very beginning? That means it was initially he started holding the neck at 6 months, then he started turning from prone to supine later, and now he's walking, but he's acquiring everything but he's acquiring it late. Or the child was perfectly okay till he was 1.5 years of age. Till 1.5 years he was walking and he was also running. And now he is not able to sit. So that is called regression of milestones. So there are two different things. So if it is a static, something like cerebral palsy, that means a one-time damage, a static encephalopathy, the insult is usually around the birth. And the child keeps on gaining some milestones, little lower than the other children, but he's still gaining. If a child has developed regression of milestones, that means he had acquired some milestones and he has lost them. It could be a one-time loss of milestones like in encephalitis. The child was perfectly okay till 2 years of age. ऐसा मेरा बच्चा बात भी करता था, गाना भी गा लेता था, बोलता था, दौड़ता था. Suddenly उसको बुखार आया, दौरे आए, and since then he's not able to do anything. So it was an acute insult, but it is static. But he has lost all his milestones. But what is also very serious is neuroregression. That's अब 1.5 साल पहले ऐसे करता था, फिर 3 महीने पहले इसने चलना छोड़ा, अभी 2 महीने पहले इसने बैठना भी छोड़ दिया. So that is regression of milestones, and it is usually autosomal recessive, and it has usually a very bad prognosis. We are able to identify the causes of some of them, but in spite of that, treatment is very limited. Now what we have to do in that case is, some of them have got treatable conditions. So we try to diagnose that, but beyond that, if they are autosomal recessive, we would like the parents to go in for complete genetic diagnosis so that they don't land up having all the children like this. Got it? So you've got one, they have got a child who's now, you know that this child is now only able to sit. But you know that with his regression, the kind of disease that he has, in another 3 months, he'll be bedridden. And he may not survive beyond 1 or 2 years. So the parents have to go through this trauma this time, because even if we diagnose it, we may not be able to treat every condition. But you don't want them to have the same problem with their subsequent child. So you go in for a complete genetic evaluation so that next time they have a child, they can go in for prenatal diagnosis. Right? So regression of milestones is always a very problematic thing and must be properly assessed. And from that you calculate roughly the developmental age. So what is developmental age? Like you expect a child to stand with support at around 10 months. Right? But now you have got a 2-year-old child and he's able to stand with support. So his developmental age is 10 months. Got it? So you expect a child to have, he's 2 years of age, but he's got only bisyllables. He's only able to stand with support. He's only able to, he takes a small toy and he has a pincer grasp spoon. He's not able to put a tower. So his developmental age is roughly that of a 10-month-old baby. That is called the developmental age. That means what a normal child would have acquired at that age, that is the developmental age. So what are we assessing? Sometimes malnutrition can also contribute to this, so we look at the growth parameters, right? Then we look at dysmorphic facies. Sometimes a child may be having certain features like Downs or Turners, and these children tend to have developmental delay. So are their facies normal like that of their parents? We also want to evaluate their vision and hearing and look at their neurological examination. Is their tone increased? Because we have certain conditions, we'll be teaching about them. You must have heard of cerebral palsy. Have you heard of cerebral palsy? Some children who don't cry after birth, who have some problems, they tend to become stiff and they become delayed. So that is the commonest cause of delay, developmental delay. So they have certain abnormalities in tone. So you have some idea what is tone? You've studied in physiology, upper motor neuron lesion and lower motor neuron lesion. Upper motor neuron lesions have spasticity. Similarly, cerebellar lesions have rigidity. So both of them are hypertonia. And all the lower motor neuron lesions, they have hypotonia. So you look at the neurological examination. So you see, you have read something in first year, you don't have to forget it. Because if you want to understand, you've got a child in front of you, he's developmentally delayed. You examine him, but in your brain you have to know what part of the brain is damaged. For that you can't afford to forget your neuroanatomy or physiology. It's upper motor neuron or lower motor neuron, then only you investigate. You can't go in, ek MRI bhi kara lena, ek NCV bhi kara lena, ek EMG bhi kara lena, because we don't have these kind of patients who are so rich. So you make a diagnosis clinically and then you investigate. So we calculate the developmental age, I told you, was the age at which the baby has acquired the milestones. So we calculate the developmental quotient. Developmental quotient means this is the age of which the developmental age is 8 months. The age of the baby is 2 years. So 8 months divided by 24 into 100. So that will be roughly around 1/3, that is 33%. Have you understood? For instance, you have a child who's say 5 years of age. So 5 years means 12 into 5, 60 months. But he has got the developmental age of a 18-month-old child. That means at 18 months, we expect a child to make a cube, 3 square cube. He should be able to run and he should be able to just scribble. And he speaks 4 to 5 words with meaning. So that is the developmental age of a 18-month-old child. So 18 divided by 60. So 18 is the developmental age. The chronological age is 5 years. That is 60 months into 100. So that will become roughly 18 upon 60 is 18 4s are 72, 18 3, roughly 3.5 you can say. It will be again roughly around 33-34%. So that is how you calculate the developmental quotient. If the DQ is less than 70, we call it delayed. Right? Then there's sometimes called dissociation. What is dissociation? We find that some milestones are normal and some milestones are delayed. Most of the children with cerebral palsy or inherited metabolic problems, all the parameters will be delayed. Gross motor, fine motor, language, social, everything. But sometimes, for instance, I told you of a child who is not able to hear. His gross motor, fine motor and social will be normal. Only one milestone will be delayed and that is language. Right? And vision, hearing, parents may not be able to tell you. So now you know only one milestone is delayed and you work that up. Or a child has got a muscular dystrophy. That means his brain is normal. So his gross motor, fine motor, all the language, social, vision, everything is normal. He only has a problem in gross motor milestones. He's not able to walk maybe. So you know it's only a muscular disorder. So you just work that up. Now IQ is something different. So when we are talking of IQ, usually we don't talk of IQ in children who are less than 2 years of age. For IQ, if you want to go in for your own IQ, we have different tests, Stanford Binet test, etc. And that is basically cognitive. It has to do only basically with the brain function. Development is something more comprehensive. It involves so many parameters you have seen. It's not only cognitive. Cognitive is just one part of developmental quotient. So in a smaller child, developmental quotient is a better predictor of the growth of a child. Cognitive tells you only about, IQ tells you only about the cognitive features of a child. Another thing is, if you have a child who was born preterm, for instance, a child was born at 7 months. Now the child is 3 months of age and she says, "Sir, mera bachcha to abhi gardan bhi nahi pakad raha hai." So is it, now the child, actually the age of the child is 3 months. But the child was born 2 months before time. So actually we calculate the developmental age as, we will subtract 2 months from that age. And we will say that the age of the child is only 1 month. We will not label the development child as delayed because we will give him time. Till 2 years of age, we give that child time to catch up. Before we label them as developmental delay and do an extensive workup, we subtract that age in a preterm baby till in the first 2 years of age. Only then we assess the development. So what are red flag signs? So actually, see, whenever we look at development, you must have seen in your class also, there will be some children who will be doing very well in certain subjects. Right? They always score so high. There are some children who score a little better in some other subjects. Right? Some children will be very good in community medicine, some are very good in pharma. Some people like learning, some people like interacting, right? Some people are very good in surgical procedures. They may not be very good with theory and all, but whenever you give them a suture or a procedure, they are very good. We had some children in class, they just passed, but the surgery was beautiful. So people have different skills. So, and mostly things are in range, right? If you have all of you, there will be a range. And if a child is within that range, we don't cause unnecessary alarm. Because we know that no two children are going to be alike, so there is a range of things. So when are we going to be alert? If we find, usually we expect a child to have some fixation even at birth. If there is no fixation at 2 months, something is wrong with the vision. At 6 months, we expect a child to start having some monosyllable by 4 months. If 6 months, no vocalization, something is wrong. Then we expect a child to sit without support at around 8 months, even if it hasn't come by 10 months. Then we start doing, we give a little bit of margin and then we start investigating. Then standing with assistant is around 10 months. So if it doesn't come by 12 months, again that's a red flag sign. If the hands and knees are, if the child is not crawling, again crawling comes at around 9 months if it's not there by 14 months. Standing alone by 17 months, walking alone by 18 months. So usually we say 1 to walk and 2 to talk. So usually we expect a child to walk by 1 year and 15 months. If they're not walking alone by 18 months, we are alert. Not speaking even a single word by 18 months, we are alert. No imaginative play by 3 years, again. So these are the red flag signs for most of the milestones combined. So WHO has given, so these are the gross, we have got 6 major milestones and this is the range. So sitting with support, so this is roughly we expect sitting without support comes at around 6 to 7 months. But some children will acquire it early and some will acquire it a little late. Similarly, standing with assistance at around, most of the children will acquire it around 9 to 10 months. But again, there's a range. Crawling again at 9 to 10 months. But some will crawl early and some will crawl a little late. Walking with assistance, standing alone, walking alone. So most of the milestones, they have a range of being acquired. So when they cross at least 2 months beyond that age, then that is the time usually when we become alert that the child is having developmental delay. So these are certain screening tests. So usually what we do is, we have certain definitive tests and they take a lot of time to give. And we have certain screening tests. So what is the purpose of a screening test? Are they better than why do we have screening tests and definitive tests for anything? So usually screening test means they have a good negative predictive value. They are easy to do, they take less time, because you are doing it at a large population, at risk. So when we have a screening test, you are giving it to most of the children who are coming in your OPD whom you are seeing. So this should be something which takes less time. So most of the screening tests are either simple questionnaires which you put to the parents or you just ask from the parents some simple questionnaires and they take just 15 to 20 minutes. The proper test that you have, the definitive tests take about 1 hour. They take more time and they have to be given by a psychologist. Again, you can't apply this definitive test to all the children. So what you do is you apply the screening test. If it is negative, then that means mostly the child is going to be normal. But if it is positive, the child may or may not be delayed. That is what it means. So they have a good negative predictive value. They may not have a very good positive predictive value. So you have Fatak's-Baroda test. This is based on Bailey's scale of infant development. So by and large, when you look at all the Western literature, they have this Bailey scale of infant development, which is supposed to be the best diagnostic test, which is based on this, and this is the test which is commonly used. If you look at all the Western studies, they are based on age and stage questionnaire, which is a questionnaire which is given to the parents. It's about 25 to 30 questions, and the parents have to answer it. Denver's 2 developmental screening test, and Trivandrum developmental screening test is developed in India. Then we have a CAT test. This is a test I was telling you about. This is a very simple test, good enough Harris drawing test. So I told you, you just give the child a copy and paper and you tell him, so I told you circle can be drawn at 3 years. So beyond 3 years, you tell the child to draw a face. If he draws a face, then he draws 2 eyes, he draws a mouth and 2 ears. So for every body part, we give 1/4 ear. So he's drawn a circle, then he's drawn 2 eyes, 1 nose, 1 mouth, 2 ears. Right? If he draws a single trunk, then 1 more body part. So how many body parts has he drawn? 8. So it becomes 2 years. So to 3 we add 2 years. So developmental age of that child is 5 years. So this is a very simple test. So it can be given to children beyond 5. So these are basically screening tests. And the purpose of a screening test is it can be given to all the children because they take less time. And then you find something is wrong, you do a definitive test. So these actually when you are examining these children, a typical child, see he's got this very good anti-gravity tone, flex posture. He's holding this ring. A child who has delay, this is how you expect that child to look, right? His tone is less, he's interested in this, but he's not able to bring his hands together. He's not able to grasp it. Similarly, this child is in the prone position. He's able to lift his head, but this child, he's not able to turn from prone to supine. Right? So this milestone would come at around 4 months. He's able to lift his head, he's able to interact with these toys. This child is not so comfortable. This is what I told you. So you put the child first in supine position, you put the child in prone position, then from the prone position you try to lift the child up. So you can see this child is holding his neck. Can you see this? And here his head is lagging behind. Then you put the child in sitting position. So at around 4 to 5 months you'll find you just have to support this child from the back and he's got very good neck and back control. But look at this child. If you hold him from here, he's going to fall. So you have to support his whole trunk and his head is falling either in front or it will fall at the back. And his back is completely grounded. So he has no neck control, no back control. Then you have put the child in ventral suspension. So this is called ventral suspension. In ventral suspension, you can see initially the child just lifts his head a little bit, but he's controlled his back, he's controlled his limbs and his head is completely off. Look at this child. No limb control and he's not able to control his head. then as soon as you bring the child downwards, you'll find this child is having a protective reflex. He's pulling out his hands and feet to protect himself. This child is not able to protect himself nicely. Similarly, when you put the child in standing position, this child has got, you can see, good neck and back control. He's holding his shoulders very much at the same level as the buttocks, and his feet are close together. And look at this child. He is not able to hold his neck and buttocks. He has to be held from here. And he doesn't have good body control. So whenever you're examining a child, you first let them lie in prone position, then supine, then you pull them up, then you put them in supine, and then you put them in ventral suspension. So in all these positions, you look at their neck control, their back control, how they are responding to, suddenly if you're bringing them down, how much they are able to control and how they interact. So these are the definitive tests. We don't expect you to know in detail. We expect you to know the names. So this is the Bailey scale of infant development, which is supposed to be the gold standard, which is applied for smaller children. So in this you calculate the psychomotor index and the physical mental developmental index. You have 4 indices. So this is for smaller children till 3.5 years, and for very small children, this is supposed to be the best test. Beyond that, for school-going children, it is the Wechsler's intelligence scale for children till 17 years, and for adults and for general public. Like when you're going to school and when they have these IQ assessment tests, it's a Stanford-Binet test and the Minden Adaptive Behavioral Scale. So this is for 2 to 85 years, and this is for 0 to 18 years. So this is for the entire population, for smaller children and for school-going children. We want you to know the names of these tests. Again, why we want to assess the development is because if you find that a child is delayed and you give them multi-sensory stimulation, you will find that the child improves. So where there are certain components of nurturing care, we expect this early childhood development that you've got, the children are they are what you have as resources, human resources. So ultimately, if you give them the best nurturing care in terms of good health, nutrition, caregiving, security, and opportunities for early learning, they will attain their growth optimally, and you will have a neurologically active population. So investment at this point of time is supposed to be a very good investment, because ultimately, it's the human resources at development that determine which country stands at which position in the world.